beauty is not external, beauty is within. It's what the soul carries. But you have to feel comfortable in your own skin. And I always say beauty is like through your eyes, through your own eyes. Because
Mm.
what you find beautiful and what I find beautiful is two different things.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Okay.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Beth Hooven, a registered nurse for 45 years and presently a professor of nursing at Mojave College in Lake Havasu, Arizona. Also the owner of Purely Balanced Beauty Medical Aesthetic Spa. She specializes in Plexar non-ablative and ablative soft surgery. She believes in providing holistic, comprehensive care in a kind and compassionate environment. So, Beth, welcome and glad to have you here.
Thank you.
Okay, so let's start at the kind of the top level. How did you first get interested in the medical field?
Um, Actually, I wanted to be a veterinarian and I wasn't able to get into veterinarian school. So I went to nursing school.
Okay, and so from nursing, I guess what led to that transition of you wanting to get in specifically into the aesthetic side of things?
I was coming into retirement years and I was teaching full time, and then I went part time teaching at the college. And one of my students and I had gone to a seminar and I got into doing the Plexar, and that's kind of how I got into it.
Okay. And so what led you to start your own practice then? I mean, why not just end up working for somewhere else?
Well, originally I was working for someone else, and due to financial situations for the other person,
Mhm.
I ended up becoming a financial backer into a full time practitioner.
Oh, wow. Okay. So basically you funded it first and then you took it over from there.
Correct.
Got it. Okay. So now that you have this practice, you talked a lot about Plexar. What
Mhm.
is Plexar for people who have never heard of it before?
Plexer is, I would say that people think of it as a plasma pen, but it's really not a plasma pen. Doesn't work off the plasma technology, as in the way that it ablates skin. Uh, so you can do soft surgery, which is just a facial. They call it Plexar shower, Rockstar treatment is, and it would be equal to microdermabrasion or microneedling without injuring the skin.
Mm,
As for the ablative piece, so I can do blepharoplasties, lines, crow's feet, scars, mole removal, tattoo removal, acne. Yes, it's pretty. So no bleeding, no cutting,
okay.
minimal downtime with really amazing results.
Okay. So is it more closer to the microneedling where it's like, I guess it's like kind of poking the skin but not damaging it, or is it more of like a laser, or like kind of what is it more comparable to, or something completely different?
It is actually, it's totally different. So no, you don't poke the skin. Actually, you hover above the skin to cause a plasma burst between hydrogen, nitrogen, and oxygen in the air, sublimates the skin, and it just goes away.
Wow. Okay.
Yeah.
So it doesn't even touch the skin. It's just a mixture of gases then.
Yes. The only time you do touch the skin is when you do, it's called cat resurfacing. So cat scratch, think of a cat scratching.
Hmm.
And you very lightly go over the skin with a special tip.
Mm-hmm.
And that then you have marks that heal within 3 to 5 days, and it starts to rebuild collagen and elastin from bottom up.
Okay. Got it. Now, for people who have never heard the term ablative, what is non-ablative mean?
Non-ablative means you're not damaging the skin. That's
Hmm.
using a different tip. And I should have brought my Plexar home, but I didn't. I'm totally like over my head. So it's a triangular tip that you touch the skin, you run over it, but you're not causing any kind of damage whatsoever. It just lifts off the dead cells, opens up small channels, which our natural body's healing is if you get injured, such as microneedling or even a chemical peel, your fibroblasts, microphage all go up to heal the area. Well, they end up doing that with this kind of non-ablative surgery, but they get trapped because the skin is not broken. And
Mm,
these little channels are open, and then you feed it from above, and all it's fed with is vitamins such as glutathione, zinc, A, peptides, whatever exosomes. You can use a variety of different serums. And as these little channels close, what I put in closes in, and so does your own body's fibroblasts. And then in the next 6 weeks, you start to build a whole bottom bed of elastin, collagen, fibrogen, everything underneath. So it's tightening, gets rid of dark circles, age spots. So that's the non-ablative.
got it. Okay, so then let's switch over to the ablative side of it. So I'm assuming the ablative side means you are doing some damage to the skin to get it to heal better and I guess rejuvenate.
Correct. So say I was doing eyes,
Hmm.
um, blepharoplasty, where you're removing the hood or underneath of the eye. You take the Plexar with a tip and you hover over the skin, and with that plasma burst, that skin actually goes away. So you're hovering and making very small dots, doing it in a triangular um, pattern, or like a dice pattern. Think of a five,
Hmm.
dice in the middle, and you're pulling this. It's removing the skin and then pulling it upward. So
Mm,
depending on where you're doing it, it depends on what kind of direction that you would put the dots.
okay. So then with the, I guess the ablative versus the non-ablative side, what are the typical results you can see from either one of these?
With a non-ablative, it's like having a facial on steroids, I call it. So skin is extremely tight, it's shiny,
Mhm.
uh, it bags under the eyes pretty much dissipate. There's instant tightening. You can see very small lines actually also dissipate, versus the ablative is, it looks like I beat you up a little bit.
Mm.
But again, the healing is very minimal. It's like downtime is 3 days,
Wow.
where you might just have some swelling. Say I did a blepharoplasty around your eyes. So ice and head elevation is what we would have to do. You would have some dots, but
Mhm.
usually by day 7, the crust is what they are. They're not scabs. They're actually carbon crust,
Mhm.
fall off and then heal.
Okay. Now, when it comes to the number of treatments, I'm sure this is going to depend on what somebody is looking for, but how many treatments on average can someone anticipate between non-ablative and the ablative side?
The recommendation is I do 3 treatments of, this is the non-ablative, the Plexar shower, the Rockstar treatment. You do a treatment every 4 weeks. So what you're doing is, when the skin is injured, when your skin is injured and that bed is trying to be rebuilt from underneath, it takes 6 weeks. Doesn't matter if you've cut yourself or whatever, you think your cut heals in a couple days, but really what's going on underneath is totally not done for 6 weeks. So I catch it in 4 weeks. I call it the hyper healing mode. So you do the shower. 4 weeks later, they come back for another treatment up the handle, which is a little bit higher energy level. And then again in another 4 weeks. The recommendation is 3 treatments, because you're catching it within that hyper healing. Um, Not quite going to 6 weeks, but keeping it at 4 weeks. So your body's already healing and in that mode. So it just starts to build thicker and thicker layers underneath.
Okay, got it. So that's why you want to give it 4 weeks because that's enough time for it to heal.
Correct.
Got it. Okay. And then how about on the ablative side?
But the time frame,
Yeah, time frame and how many? Is it also 3 or is it typically less or more or
it depends. It really depends. If somebody comes in with pretty bad hooded eyes, I the prices for up to 3 treatments. I might have to come back and redo, because there is swelling involved, and somebody might swell. I might swell faster than you swell, and some of that swelling may look like extra skin, but not.
Mhm.
So, um, up to 3. Usually, 2 is pretty much my average.
Okay. And you mentioned that you're giving a lot of examples on eyes, but is this really Plexar just for face, or it can also be done on the rest of the body as well?
Absolutely, the rest of the body. Actually, in Europe, it's probably they do about 90% of their surgeries, facial lifts and things like that with it without cutting. It's been in Italy for over 15 years.
Mhm.
It's been
Wow.
here, yeah, it's been here in the United States for maybe about seven. I think Med Results is the company that brought it over.
Mhm.
Um, so you can do pretty much, they use it in interocular surgery, they use it in dental surgery. You can do vaginal rejuvenation with it. It's the
Wow.
same handle, it's just
Mhm.
a different tip that goes on the end of the handle.
Mhm.
Yeah, so you can tattoos, I mean, anywhere on your body, scars.
Mhm.
I would say probably 75% of my stuff is done on the neck up because you
Mhm.
can do like the turkey neck here. You can do actually the nose, like remodeling the nose. You can do jaw lines. Um, yeah,
Wow. Okay.
yeah,
So when it comes to these benefits, it just seems like it's a very versatile machine.
it
So
is.
what, I guess, how would you compare it to a lot of the other, maybe not direct competitors on the market, but like if there's other types of modalities out there, is Plexar kind of the one that you feel is just the most superior all around, or would you say that Plexar is really good in certain situations, but it's maybe not the best fit in other situations that maybe another type of machine would do better in?
Well, I think as technology has gotten better, especially with lasers lately, I mean, we've old time lasers did a lot of damage underneath the skin, necrosis and things that people did not see. You know, now that they've come out with CO2 lasers and high refractory lasers, I think that the technology on the lasers, when Plexar came out originally, it really was topping lasers because you were not damaging that under part of your skin. You weren't going through, you weren't causing any necrosis or any damage because you're not going all the way deep down and almost to, I mean, it's just superficial above muscle line if you really think about what how lasers work. Um, so competitively, at least where I'm at, I'm the only person in town who does it. And I have a lot of people also price wise. I mean, if you go for some CO2 lasers, you're talking five, $6,000
Mhm.
for treatments, whereas I can do eyes for 1,000.
Oh, wow. That's a big
And
difference.
right, and a normal blepharoplasty surgically, if not covered by insurance, because you have decrease in peripheral vision, because insurances will cover that, but
Mhm.
you have to not be able to see from your outside,
Yeah.
can be upward up to 15, $20,000. So you're talking, you know, quite a savings of money, especially when you're talking out of pocket.
Yeah. Okay.
Yeah.
Now, I'm sure you get this question a lot. Is it painful?
I use high test numbing ointment. It is from a compound pharmacy, so it's lidocaine, vivicaine, and novocaine together.
Mhm.
I numb for 45 minutes prior to starting, and I make sure that that numbing's kept up. You know, that if they might feel a little tinges, but it's nowhere near. You know, it's not cutting.
Mhm. Yeah.
No. So
Okay.
there's no anesthesia or anything
Hmm.
intravenous or oral anesthesia that's given. It's just all topical.
Got it. Okay. Now, I want to talk about some of the common misconceptions or myths that you hear from your clients and your patients about the Plexar. Because again, I've heard the name, but I don't know anything about it. So I'm
Yeah.
asking all these questions. I'm sure like you have a lot of people that come in, they just don't know anything about it, and so you hear a lot of common myths or misconceptions. What are some of those most common ones that you hear?
Um, really no misconceptions because just as you haven't heard about it, so it's all in the education and the company Med Results does an amazing job not only with training but constantly updating the machine. The machine itself does have tutorials on it. So I can sit there and I can show the patient exactly what it is. My website is very educational. I always do a consultation beforehand
Mhm.
and say, okay, now let's, as an educator, go do your homework. Go look it up. These are all the resources. Go out there and look at us since you don't have anybody to compare to, and that So the misconceptions aren't out there. It's just a lot of education on why this is a better route to than going and doing a laser resurfacing or having that blepharoplasty. And a lot of times, I mean, blepharoplasties, I do quite a few, is it's that piece there. I don't like what my eyes look like, but I haven't been cleared by my ophthalmologist to be able to have a surgical blepharoplasty.
Mm,
Besides that, you look like a raccoon for 3 months, 3 weeks.
yeah.
Not for me. You only look like a raccoon for me for about 5 days, but compared to, and I actually had the conventional blepharoplasty because I had vision loss secondary to hooded eyes.
Mhm.
And that was done about 15 years ago. And then I have had blepharoplasty with the Plexar, and hands down, it was a much better recovery, much quicker.
Okay. And how do you approach that educational part? Because kind of as we talked about, like I really don't know anything about it. I'm sure a lot of your clients and patients don't know anything about it. So how do you approach that educational component so that they understand what it is, they understand the benefits, they understand the potential downsides of it, so that they're really comfortable with moving forward with it?
Well, I start with going through the healing of the skin and why this is better versus cutting.
Mm,
And then I take them over to the machine and I actually pull up the tutorials and show them somebody doing it. I show a couple of videos of me doing it. Then I have quite a few pictures of people, the befores and the afters.
mm. Okay. And then from there, that basically makes you feel them, make them feel comfortable, confident that this is going to get them the end results they're looking for.
Actually, I have a few patients that they allow me to give their number out and they'll call.
Okay.
Yeah, and they'll say, yeah, this is what it was. This is how long it took me.
Hmm.
This is what I felt like. The swelling looked bad, but after 3 days, and and I always tell them, don't plan anything for this amount of time. You're going to have to ice and elevate.
Hmm.
You can't take Motrin or any kind of anti-inflammatories. You're okay with still doing an anticoagulant, so anyone who has heart issues can still do it again because you're not bleeding.
Hmm.
There is no bruising,
Hmm.
so it's just a matter of swelling.
Got it. Okay. So let's say, Beth, that someone is interested in getting this treatment done, but they are trying to figure out which provider to go to, a provider knows what they're doing, has experience, can get them the results they're looking for. What advice would you give to that person as they're doing their search, trying to find a provider that is a good fit for them?
Well, there's nobody else in town for that for us, so it's like, okay, well, if you want your eyes done, I can do this, or you have to go to doctor such and such down the street for a possible surgical blepharoplasty.
Mhm. Okay. And what if someone's like in another city or in a city where there's multiple providers that offer the same thing?
Um, LA is probably the next place closest to us. So we're in Lake Havasu, Arizona. So Phoenix is 3 hours from us. LA is about 5 hours. There is two practitioners in Phoenix.
Mhm.
There's a multitude in LA. So you can go to LA, but my $1,000 just turned into $5,000 in LA.
Mm.
So, you know,
Mhm.
you
So
can go on actually you can go on Med Results website and Google, closest practitioners or whatever and do some price comparison. And
okay, so it actually may make more sense to travel to another state uh, to get this done than to try and do it in your own city if you're in a very competitive area like Los Angeles or maybe New York or Miami or something like that.
yeah,
Ah, okay, good to know. Okay, so Beth, when it comes to what you do, what role do you believe creativity plays in how you approach your client care? Because I think when people think about medicine, creativity is not the first word that comes to mind, but how important do you think it is in what you do?
I think my teaching, again being small community that we live in, and we only have one college here and we have a very robust nursing program. So using that as one of my backgrounds of like, I really want to educate before somebody sits down and decides to do this.
Hmm.
I go do your research. No one walks in the door and has it done that day. That is for sure.
Mm.
There is a lot that goes behind it. to make sure that they're comfortable with it and understand.
Hmm. Okay. So a big
Yeah.
part is just education, making them feel comfortable, understanding everything that goes into this.
Right. And having the contact with past patients, saying, here, call Susie. She had this done a year ago. How
Hmm.
does she feel about it? She's, and then, text Susan and say, hey, Janie's calling you and she wants to know, please give her, the good and the bad and the ugly, if anything.
Hmm. Well, that's awesome. That's amazing. You have people that's willing to give that for you. Now, and that actually leads me to kind of my next question here is that I'm sure that throughout your experience, you've had some memorable or maybe even challenging cases that you've had to work on. Is there maybe one story that you can share of one of those cases and how you were able to get them a great result in the end?
I do have one client and he had horrible, horrible pudding. I mean, where he should have gone and gotten it done surgically. And when he came in and saw me, I was like, you can go and do this through the VA and they can cover this. It's bad.
Mhm.
It's going to take more than 3. I can tell you that right now. You're having to make sure that you wait at least 6 weeks in between an ablative procedure because you want that whole healing. And I personally do 8 weeks. I just want to older clientele. You just really want to make sure that what you're working with underneath is good, and they'll come back and maybe even after 8 weeks, I look and say, we might have to wait another 2 weeks. I just wanted to heal a little bit more.
Mhm.
And after 3, we got him from totally being, I mean, where he could hardly even open his eyes up. They were really,
Wow.
really bad.
Mhm.
And I said, okay, well, we've done 3. I told you it was going to be more. Are you happy? Can you live with what you have right now? Because he was like, I don't know if I really want to do more. And I said,
Mhm.
that's fine. But I told you I knew it was going to take more than 3. I,
Mhm.
and so at least he can see now.
Mhm.
And he goes, you know what? Maybe in about 6 months I'll come back. But, I'm going to take a little break.
Yeah. Wow.
And he really didn't have the best pain tolerance.
Mm.
It took quite a bit to numb him.
Mm.
Yeah.
At least he's able to see now, though.
He can see, and you can really see a huge difference.
Yeah.
But is it all gone? No. Would I like to have done more? Yes, but he can live with it. I'm good with that.
Got it. Got it. Now, Beth, where do you think the future of aesthetics is going?
Wow. So, besides doing the Plexar, that's what I do. We do Botox and we do fillers there. I have a couple other people who work in the spa. So you have that the oldies but goodies, I would call them that.
Mm.
The Botox and filler. We also do body sculpting. I think that with combining modalities is really the future because kind of aesthetics, I think when we think about this, Botox and filler was the only thing out there. And then slowly, like the laser microneedling came out. In history wise, and then dermal abrasions and chemical peels. But now with all that, I mean, there's so many things that are out there now.
Mhm.
It's it's just it's kind of mind blowing.
Mhm.
You could spend $1 million on all different kinds of equipment to hit all different kinds of stuff. I mean, it really is mind blowing. And the younger they're starting young.
Mhm.
I see kids coming in at 20, 25 wanting Botox. It's like,
Why?
what do you want to inject? Well, this is preventive, and just having maybe like 5 or 10 units, sprinkled across the forehead or around the lips, or I mean, younger ones you see is the lips, is the enhancements on your lips. But it's like really at 25 years old. I mean, that's I never wouldn't even have thought of that when I was 25. But then again, when I was 25, I didn't have it. So
Yeah. Okay.
yeah.
And with that in mind, what is your vision for your practice, Purely Balanced Beauty?
I like the little niche that we have. I mean, we cater to, I would say, 45 and older.
Mhm.
again, it's a retirement community, so I'm very cognizant of pricing, not only in procedures, but also in products. So I make sure that the product that I carry is within reason. It's not $800 for, a kit. That retirement people can't handle that, but they still they don't want to look 25, but they want to look their best. And I think that's pretty much my sale. And that's why I keep a steady business, is because I see somebody and then the girlfriends come in, and it's definitely, it's word of mouth for me. It's in our very small town, we have at least 10 different aesthetic spas. When I opened up, we had 4. So everybody wants to get in on it.
Yeah. Okay. Well, Beth, I have one last question for you. But before I ask it, I do want to point people to your website at purelybalancedbeauty.com. Now, last question for you. What does beauty mean to you?
Beauty is not external. Beauty is within. It's what the soul carries. But you have to feel comfortable in your own skin. And I always say beauty is like through your eyes, through your own eyes. Because what you find beautiful and what I find beautiful is 2 different things.
Awesome. Well, there you have it. Beth's expertise. So Beth, where can people contact you in your practice?
They can go online. They can book through online, or they can call me directly at our 926-846-1545. Do a lot of, I'd like to call and talk to somebody first.
Awesome.
It's definitely very verbal.
Okay.
It's the teacher in me.
Yeah, I get it.
Yeah.
Okay. Well, Beth, this is awesome. Thank you for coming on, and thank you for sharing your knowledge and expertise.
Oh, you're welcome. Thank you for inviting me. And go look up the Plexar.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.